So if you have come in for annual physical or routine physical and you are an adult, then we'll do some basic testing. And basic labs include complete blood count, comprehensive metabolic panel, hemoglobin A1C for diabetes, then thyroid testing, just the basic test for thyroid function. We also check for lipid panel, which is cholesterol, and then we do urinalysis and sometimes C-reactive protein and vitamin D levels, and then additional testing based upon patients' concerns and needs. But breaking the basic labs down, I'll just explain those here. So complete blood count is basically hemoglobin, which is basically checking for anemia, where people can have iron deficiency or vitamin B12 deficiency or folate deficiency or thalassemias, and then there are some uncommon causes. So in other words, if your hemoglobin is low, then we need to do further testing to see what is causing it. Low hemoglobin or anemia can give rise to a lot of fatigue or tiredness and other symptoms too. If the hemoglobin level is high, which is called polycythemia, that's also not a good thing because it means that it puts you at risk for clotting disorders and makes your blood very thick, and this can happen as a result of either a primary disorder of the blood or sometimes people being on hormone replacement treatment. For example, testosterone can have elevated hemoglobin levels, so we need to monitor that. Sometimes people who smoke or have chronic lung conditions can also have elevated hemoglobin levels, and in some situations, rare conditions, it can be a sign of cancer. The bottom line is we need to do further testing. The next thing on this particular lab test is white blood count. If the white blood count is high, then it is usually a sign of infection or inflammation or an underlying pathology which is giving rise to inflammation. And in some situations, it can also be a sign of blood cancer or bone marrow cancer. So again, we need to do further testing. The next thing on the complete blood count is platelet levels. So platelets are tiny, small cells, and usually if they are slightly high, that is just a sign that maybe body is responding to some stress. But if they are low, then that is a matter of concern, and that can happen either as a result of thrombocytopenia, which is an autoimmune condition. It can also happen whenever people have chronic infections, for example, hepatitis C, or a liver disease can cause a low platelet count. So we need to test for all those things. So that is complete blood count. Now, the next thing on the routine checkup where we do the labs is comprehensive metabolic panel. And comprehensive metabolic panel is an extremely useful test because with the help of this single test, we can tell about the specific functions of multiple organs in the body, at least at a baseline. So it's not a very detailed test, but it gives us a very basic, superficial information about multiple organs in the body. So the first thing that we see on this is BUN and creatinine, which are basically the test of functions of the kidneys. So if these levels are high, then we start to worry about the kidney function. And between these two, the creatinine is more important than BUN because BUN can be high because of muscle mass as well. So we specifically look at the creatinine level. So these should be normal. If they are not normal, that's concerning. The next thing on this particular test is glucose levels, which is basically just a random glucose. So that is not as important as hemoglobin A1C, so we'll come to that in a second here. And then there is a little bit about GFR, which is a kidney function, which is more of a calculated number. And then we, of course, look at sodium and potassium and chloride and carbon dioxide. And those levels are basically the small molecules in the blood. Some of these are electrolytes, for example, sodium and potassium. And if they are high or low, then we definitely need to address them and manage them, and also find out, more importantly, what is the underlying root cause. The sodium levels should not be very high or very low because it can cause confusion and multiple symptoms. Similarly, if the potassium levels are low, it can cause cramps in the body, and usually they are low whenever people are taking medicines, for example, blood pressure medications, or if they are dehydrated, or if they're not eating very well. So those are the things that we look at to make sure that the body's electrolytes are normal. The next thing on this set is calcium. Again, this is a random calcium, so sometimes people get worried about the calcium level being a little too high or low. So something to keep in mind is that if the calcium level is high on this particular lab, it doesn't necessarily mean that the body's total calcium is high. It just means we need to do further testing to see the metabolism of calcium. So another test needs to be done. The next thing is proteins, so which is basically total protein and albumin and globulin and the ratio. And the protein levels should be normal, but then again, if they are low, then it's usually a sign of malnutrition or another problem in the body. On the other hand, if the total protein or the albumin is high, then we start to worry about things that are inflammatory conditions in the body or even cancer conditions, for example, multiple myeloma and other things. So that's another thing to address. Those are not very common, but of course, if these numbers start to show up high, we need to start looking into those things. The next 4 things are basically related to liver. So that is your bilirubin, your alkaline phosphatase, AST, and ALT. So bilirubin is a marker of liver function, and usually the number is normal, but it can be slightly high even in normal situations. So especially people of Asian descent, if they fast, their bilirubin level can go up slightly. So that is not worrisome. But if it's markedly high, then we need to start to worry and check for other things. Bilirubin also comes from blood. So if there is too much blood cell breakdown, then the bilirubin levels will go up. But that's not a very common condition. The alkaline phosphatase is another enzyme that is circulating in the blood, and that can be high whenever there is either a liver problem or there is a bone problem. So we definitely need to dig further and look further. Now, in young adolescent children who are growing and who have still not achieved their full height, they can have elevated alkaline phosphatase levels, and that is considered normal. So in those situations, we don't have to worry about it. ALT and AST, which are 2 very important enzymes that come from the liver cells, are extremely important, because if they are high, then they show usually that there is a problem in the liver itself, in the tissue of the liver. And the most common causes of liver problem are fatty liver or non-alcoholic fatty liver disease, which is rising very fast in the US because of the rates of obesity and high fat diets. So people are showing these numbers to be high even when they are not consuming a lot of alcohol. The second reason for these levels to be high would be, of course, alcohol consumption. So people who drink a lot, they can have high ALT and AST and other markers too. Then it can also occur as a result of hepatitis, for example, hepatitis C or B or any infection on the liver. The liver enzymes can also be high for many other conditions that cause liver disease, but of course those are not as common as these 3 that we just discussed. So that is as far as the comprehensive metabolic panel is concerned. As you can see, that all kinds of different organ systems in the body can be looked at superficially by doing this small blood test, and it's done quite commonly and routinely. The next set of labs on the routine checkup is going to be your cholesterol panel. So if your total cholesterol is less than 200, that's great, and then the additional components of this panel are triglycerides, which should be normal, your LDL and your HDL. Now, your LDL is the bad cholesterol, so if your LDL level should be low, preferably less than 100, and your HDL should be high, preferably above 40. So if you can keep those numbers in that range, that's great. And then the next important marker number on this small list is the LDL to HDL ratio, and ideally this ratio should be kept under 2, lower the better, because your LDL, which is the bad cholesterol, should be lower. Now, sometimes when people have high cholesterol, if they have cardiovascular risk factors from other sources, for example, diabetes or obesity or family history or other things, then we can also do advanced lipid panel. And advanced lipid panel basically gives us not only the particle size of the lipid markers, but also the particle number. So the number and the size both are represented on the advanced lipid panel, and that gives us a really good information in terms of how the bad cholesterol is sticking to the blood vessels and causing thickening and hardening of the arteries. So that's another test that can be done. It's not a routine test, but it can be ordered. Then another test that can be ordered whenever we suspect a liver, we suspect that there may be a cardiovascular problem is the lipoprotein A, and that again gives us very valuable information. The next thing that is on the routine checkup is thyroid function, and the routine checkup will be very basic and superficial, and that is your TSH and total T4. So if your TSH is normal, which is thyroid stimulating hormone, that's good. If the TSH is low, then it means your thyroid is functioning very high. So it's in the opposite direction. And if the TSH or thyroid stimulating hormone is high, then it means your thyroid hormone itself is suppressed. So you always want it to be in the normal range. Vast majority of the times when people have thyroid problem, it's actually thyroid functioning low, which means the TSH will be high. And people who have this condition, we call it hypothyroidism. They are usually tired. They have a lot of metabolism problems. They may be depressed. They may just have overall slowing of the body, constipation, cold intolerance, hair and nails problem, cognitive dysfunction, sleep problems, weight gain, and all of those things. So therefore thyroid hormone is extremely important, and we test it because about 15 to 20% of the population has this problem. The next test on the routine checkup is C-reactive protein, and again this is not always tested, but oftentimes is a marker that is checked. And C-reactive protein is just an overall marker of inflammation. It's just like saying that I'm checking for smoke, but I don't know where it's coming from. So if the C-reactive protein is high, then it means there is inflammation happening somewhere in the body. So we just need to then start to go after that. If it's normal, then it's a very reassuring sign. And sometimes the C-reactive protein is high because of infection, sometimes it's inflammation from chronic diseases, and in some situations it can be high just because of obesity, which is now considered actually a metabolic disease. So we need to start looking at why the C-reactive protein is high and start digging further and deeper. So this is as far as the basic blood tests are concerned. The urinalysis or urine test is another very valuable test that gives us information of the kidney function, but more importantly it tells us how body's toxins are being released, and if there is any protein in the urine, if there is any markers of infection, if there are any ketone bodies, if there are any casts or signs of kidney injury. So for that reason urine test is very valuable. So this is in a nutshell information on the basic labs and how you can understand your basic lab test results. I hope it is helpful. Thank you.